The skin turgor here, what does the skin turgor means? A skin turgor means that you pinch the skin and then, so like you let it go and it's smooth again. Why? Because we have elastin and collagen where? In the dermis, in the dermis. So now there is heat, like it was hot last week, and so the elderly are very prone to heat stroke. I said it this morning. What did I say about the subcutaneous tissue? Their subcutaneous tissue is wasted. So in other words, they're gonna be more prone of getting heat stroke because the heat will travel inside, and then the fat that is an insulator is not there. So what happens to their body? They're gonna boil. Right. I mean, I'm just making it like a little bit more exaggerated, but like I just want you to understand. Yes.
Just quick question, because you said we should remind you next week. So, are we gonna have lecture after our test?
Yes.
Okay.
Okay, we're going to do head and neck.
Okay.
So head and neck is not included in the lecture. Yeah. So you have only 1 hour test, 1 hour lecture.
Okay, so we remind you during the lecture.
Yeah.
Okay.
Yeah. All right. So now she's recording it, no reminder. Okay.
Oh. Okay.
All right. So now, why now that the elderly are more prone to dehydration? So that you're an ER nurse, and then this elderly patient is coming. All right. So you're going to be assessing the skin turgor. So obviously, in elderly, what happens to the skin turgor? I said it this morning. Their elastin is gone or lower, and then elastin and collagen. So for that reason, what happens to the skin? Wrinkles, right? So like you come to the hand, and then you're going to be pinching. So already the hand has a lot of wrinkles, right? Okay, so you pinch and then you let it go. You pinch and you let it go, like, and then you're looking and it's already wrinkles. So you don't know, is it tenting or is it wrinkle? So where do you check it? The sternum. The sternum. So in other words, the sternum here, like you pinch the skin, and if it's tented, it means that the person is dehydrated because this is the skin that is less affected from collagen and elastin. So have you seen any wrinkle on the sternum? I don't know. We haven't examined wrinkles, so like there is no wrinkle on the sternum. Is that clear, guys? So pinch, and then if you see that okay, it went back normal, so there is no tenting, so there is no dehydration. Okay, what else you're going to be checking for dehydration? Conjunctiva. So like you pull the skin down and then you look to the conjunctiva. Conjunctiva, if it's dry, that's dehydration. You open the lips, and then all the buccal mucosa, it's dry. So that's dehydration. All right, so what is the priority? Goes to pinching the skin on the sternum. If there is no tenting, it's a good sign. All right, and then conjunctiva and the buccal mucosa. Obviously, by then you're going to have lab tests done. So if the lab comes, what is it going to show? It shows that BUN is elevated, creatinine is normal. Creatinine is normal, the kidney is working okay, but BUN is elevated, and that means that there is dehydration. Okay, do you understand this? So this is, you're going to see these patients because you can't control the weather. People are going to come dehydrated, right? Okay, so this is like a very classic nursing assessment. So, okay, thank you, Aghavni. So this much.